On behalf of the Board of Directors of the Pan American Health and Education Foundation, it is my pleasure to welcome all of you. For more than 4 years, PAHEF and PAHO have worked together to promote health for all in the Americas. Our joint endeavors include, as I mentioned earlier, the PALTEX program, which provides affordable textbooks to thousands of health professionals through the Americas. The awards program that we are celebrating tonight recognizes leaders in public health in the Americas and is one of the main items in our agenda. We all recognize that improving public health through the Western Hemisphere is no small task. In fact, it may seem like an insurmountable ambition at times. However, progress is being made every day. Each time a child is vaccinated or an individual is given knowledge they need to stay healthy, we are gaining ground. But these efforts are most successful when all of us unite to advance health in the region, whether we come from government, organizations, foundations, advocacy groups, or private industry. And this is the second item of our agenda tonight, a celebration and recognition of this partnership. As Edward mentioned earlier, our main purpose tonight is to honor exceptional men and women who are improving health in the Americas. Every year, the Awards for Excellence in Inter-American Public Health recognize contributions in the key areas of leadership: veterinary, public health, health literature, voluntary service, and bioethics. This year, we have added a new award, which we will be presenting for the first time, the Sergio Award for Excellence in Universal Public Health. Tonight's event would not be possible without the support of our contributors. At this time, I would like to recognize our gold contributors, the Coca-Cola Company, Novartis, PepsiCo, Pfizer, and Sanofi Pasteur, whose gracious supports make it possible for us to celebrate the outstanding accomplishment of this evening honorees. It is now my honor to invite Dr. Mirta Roses, Director of the Pan American Health Organization, to join me on stage to present the awards for excellence. Dr. Roses, besides being the director of the Pan American Health Organization, is the first woman to head the world's oldest organization in the Americas. The Abraham Horwitz Award for Excellence in Leadership in Inter-American Health recognizes committed leaders and their contributions to public health, resulting in region-wide improvements in the lives of peoples in the Americas. In addition to the recognition of professional accomplishments, the awards call attention to health concerns throughout the Western Hemisphere and is intended to inspire continuing achievement by professionals in the region. 2010 is a notable year for this award as it marks the 100th anniversary of Dr. Horowitz's birth. I would like to recognize the presence of Dr. Horowitz's wife, Mrs. Cecilia Horwitz. Would you please stand and be recognized? It is my honor to present this year's Abraham Horwitz Award for Excellence in Leadership to Dr. Carlos Montero. He is currently a professor in the Department of Nutrition in the School of Public Health at the University of São Paulo in Brazil. Dr. Montero has more than 30 years of leadership experience in research and teaching. His work has focused on child health, nutrition, and epidemiology. Stunting is a condition that impacts malnourished children and they are not able to fully develop. Dr. Montero's recent work focused on the decline of child stunting in Brazil, a work that has been widely cited among his peers and is viewed as an outstanding contribution to the knowledge base of nutrition in the Americas. He has focused a great deal of his research on his home country in Brazil and working with great dedication to reduce inequities in nutrition, health, and development within his nation's borders and beyond. Please join me in congratulating Dr. Montero in receiving the 2010 Abraham Horwitz Award for Leadership in Inter-American Health. The discipline of bioethics studies ethical issues that result from advances made in the field of biology and medicine. The government of Mexico and PAHEF, in cooperation with PAHO, created this award to support scholars in their capacity to analyze bioethical issues. The winner is selected on the basis of a proposal they write exploring current issues in the field of bioethics. This year's Manuel Velasco Suarez Award for Excellence in Bioethics is presented to Dr. Paulina Taboada, the director of the Center for Bioethics at the Pontifical Catholic University of Chile. Dr. Taboada is a medical doctor specializing in internal medicine and has clinical experience in palliative care. She is the first Chilean to win this award. Her proposal is entitled Ethical Issues Related to End-of-Life Sedation. Her proposal explores 5 ethical criteria medical professionals could use when determining the use of palliative sedation at the end of life. She proposes that these criteria could become best practice in relation to dying with dignity and could be applied in Chile and other Latin American countries. These criteria for this have never been established and would be highly useful to serve as a guideline for medical professionals. Please welcome Dr. Taboada, recipient of the 2010 Manuel Velasco Suarez Award for Excellence in Bioethics. Sorry, a very important omission. Dr. Córdoba, the Secretary of Health of Mexico, is going to bestow a medal that is part of the award. I should add that this beautiful medal has been made possible by the general support of the Velasco Suarez family. So thank you for this special contribution. The Sergio Arouca Award for Excellence in Universal Healthcare was created this year by PAHEF in cooperation with the government of Brazil and PAHO. The award recognizes those who have strengthened and increased access to universal health care. This can be done in a variety of ways and may include promoting and implementing effective management of health system, developing policies for universal health care, and introducing innovative programs for the training of healthcare workers. Dr. Maria Fatima de Souza has the distinct honor of being the first person to receive this award. She's an associate professor at the University of Brasilia in Brazil, and as a public health nurse with a doctorate in health science and a master's in social science, Dr. Souza has dedicated her career to improving universal health care in Brazil. Her contributions include supporting the creation of Brazil's basic healthcare information system and defining the conceptual underpinning of the basic healthcare and basic operation standards for the unified health system. For 10 years, she served as the national manager for the Community Health Agents program, an agency that served more than 116 million people. In 2003, she created the Family Health Study and Research Unit at the University of Brasilia. Please welcome Dr. Souza, recipient of the 2010 Sergio Arouca Award for Excellence in Universal Health Care. The power of volunteerism and dedicated passion of a small group of people cannot be underestimated in its ability to affect change. The Clarence Moore Award for Excellence for Voluntary Service honors a voluntary or non-governmental organization for outstanding public health contribution that have a profound impact on improving the lives of people in the Americas. This year's Clarence Moore Award is presented to the Peruvian League Against Cancer. In much of the region, cancer rates remain high. There is a 10–12% probability of developing cancer before age 65 in many South American countries. To battle cancer and improve outcome for those who are suffering from the disease in Peru, the Peruvian League Against Cancer was founded in 1950. Headquartered in Lima, the League's efforts are widespread throughout the country thanks to the diligent work of its 18 branches. With the assistance of a dedicated corps of volunteers, the nonprofit works tirelessly to diminish the incidence of cancer through prevention, detection, and education. Here to accept the award is the organization's chairman of the board, Adolfo Rafael Damen Ludovic. The lives of humans and animals intersect daily. We must ensure that the animals we rely upon for food and other resources remain healthy to in turn help us stay healthy and avoid the host of illnesses. The Pedro Hacha Award for Excellence in Veterinary Public Health recognizes outstanding research based on a thesis written by an undergraduate student in veterinary public health and encourages dedication to the highest standards of study and professionalism. I would like to take a moment to recognize the presence of Mrs. Hacha and Mrs. Hacha Reddish, Dr. Hacha's wife and daughter. Please stand to be recognized. Dr. Louisa Sonali Moreno is the recipient of this year's award. She is a promising young researcher who is a graduate of the School of Veterinary Medicine and Animal Science at the University of São Paulo in Brazil. Dr. Sonali Moreno's research interests are focused on safety issues related to the animal-human relationship, especially involving foodborne pathogens and their impact on human health. Her winning thesis focuses on how the Brazilian pork industry is impacted by Listeria monocytogenes, a virulent foodborne pathogen found worldwide that can be lethal to humans and animals. Her work that there are various opportunities for Listeria monocytogenes to contaminate pork products as they travel from the slaughterhouse to the marketplace. This emphasizes a need for ways to combat this contamination and to help keep the end consumer safe from these potential fatal bacteria. Please welcome Dr. Luisa Sonali Moreno, recipient of the 2010 Pedro Hacha Award for Excellence in Veterinary Public Health. We would like to recognize the Hacha family as well for their support for this award. It is now my pleasure to turn the microphone over to Dr. Roses to present the PAHEF Award for Administration and the PAHEF Champions of Health Award.
Good evening, dear friends and colleagues. In the past years, events in the America have brought into sharp focus the importance of the interconnectedness of health, security, and human well-being. Human security means protecting not only the vital freedoms, It means protecting the people to exposure to threats and to certain situations, strengthening the population's strength and aspirations. It also means creating systems that facilitate the basic elements of survival, dignity, and life for the population. The threats to the safety of the people in general, to women, to communities, to the ethnic groups, were not sufficiently assessed as potential threats to human safety in general. Neither poverty, the spread of diseases, the destruction of the environment, the lack of access to water, maternal health, and not having regular employment. Until the end of the Cold War, the states and governments had not considered as a priority the daily insecurities that common people face. Human security means equitable access to education, work, and health, as well as the respect of human rights as essential components of human security, without denying the obligation of guaranteeing national security by the governments. In the 2002 Declaration of Bridgetown, the OAS member states recognized the multidimensional nature of hemispheric security, noting its political, economic, social, health, and environmental dimensions. In the 2003 Declaration on Security in the Americas, the countries declare that the basis and purpose of security is the protection of human beings. From our side, PAHO produced a report, Health and Hemispheric Security, which argued that health is a national and international security interest and an intrinsic part of human security. Better health leads to greater human security, and greater human security leads to better health and quality of life. Threats to human security, chronic ones such as hunger, disease, and repression, and threats that are sudden and cause harmful disruptions to daily life. Failure to provide protection from both these kinds of threats can impede human development and lead to social conflict and even violence. In this way, human security, security for people in their daily lives, is also clearly related to collective security and to the state. For that reason, as you can see, we are all part of this challenge, and we have the commitment to face these threats, to improve the people's lives. In this opportunity, I would like to acknowledge these distinguished professionals as great contributors in the cause from their respective areas of expertise. Thanks to their work, we live in a more secure hemisphere, but we still have much more to do. They are also our role models. Let me introduce you our awardees for Administration 2010 and our PAHO Champion for Health for this year. The PAHO Award for Administration 2010 is given to Dr. Elsa Yolanda Palou of Honduras for the national and sub-regional impact of her administrative, medical, teaching, and research activities on the quality of care to patients with communicable diseases, especially those living with HIV/AIDS. During her 25-year professional career as a medical infectious disease specialist, Dr. Palou has played an important role in the management and training for HIV patients' care in both Honduras and in the region. She has been a key player in the implementation of the National Commission of AIDS and important initiatives such as the Global Fund Project in Honduras. Dr. Palou has pioneered new medical training, contributed to the development of regional and national technical guides. Her work and vision made a difference in the quality of care given to patients with infectious diseases and of those with HIV/AIDS. Please join me in congratulating Dr. Palou, our award for PAHO Administration 2010. Fernando Javier Sendra, humorista argentino, es muy bien conocido a través de toda la región por su personaje y por sus historietas que han servido para muchas generaciones. Tiene un perspicaz y astuto personaje protagonista que se llama Yo Matías. Para la Copa Mundial de Fútbol de los años 2002, 2006 y 2010, Sendra ha donado gentilmente y ha concedido su permiso a la Organización Panamericana de la Salud para usar su caricatura, Dos grandes pasiones de mi vida, fútbol y pecho, para promover la lactancia materna con el lema La leche materna, primer alimento de campeones. En la Copa Mundial de este año se llevó a cabo una campaña a favor de la lactancia materna usando la caricatura de Sendra en 4 idiomas, español, inglés, portugués y francés. El cartel de la Semana Mundial de la Lactancia Materna del 2010, organizado por la Organización Panamericana de la Salud, también utiliza una caricatura de Sendra. La reacción favorable a esta campaña muestra el poder del humor para transmitir los mensajes de salud pública. Sendra es autor de más de 20 libros, incluidos 10 de la serie Yo Matías. Empezó su carrera como humorista gráfico en 1973 y ha publicado en muchas revistas y periódicos importantes. En 1990, su tira Prudencio, ahora llamada Yo Matías, empezó a aparecer en Clarín, el diario más popular de la Argentina. Felicitaciones, Sendra, por su generosidad en ponerse al servicio de la salud en lo que nosotros llamamos la hermosa asociación de Saludarte. Permítanme que les presente a Sendra.
Tonight, we are very fortunate to have with us Dr. Roger I. Glass, a leading figure in public health. In 2006, Dr. Glass was named Director of the Fogarty International Center and Associate Director for International Research by NIH, Director Dr. Elias A. Zerhouni, in 2006. He joined the Centers for Disease Control and Prevention in 1977 as a medical officer assigned to the Environmental Hazards Branch. In 1984, he joined the National Institutes of Health Laboratory of Infectious Diseases, where he worked on the molecular biology of rotavirus. In 1986, Dr. Glass returned to the CDC to become the chief of the Viral Gastroenteritis Unit at the National Center for Infectious Diseases. He has co-authored more than 500 papers and will deliver tonight's keynote address entitled Global Health Research: Can the Public and Private Sectors Work Together? Please help me welcome Dr. Roger Eyeglass to the stage.
Well, buenas noches. I'm deeply honored to be here tonight to speak with you. I started my career in Latin America 45 years ago, and I've been going back ever since, so I feel very comfortable in this environment. When I first went to Latin America, I was interested in studying diarrheal diseases and malnutrition, and I worked in Guatemala and Peru to think about the causes of malnutrition, the interaction of malnutrition and diarrheal diseases, and what could be done about these two problems. About 35 years later, my daughter went to Peru for the summer as a medical student. She went to an Institute of Nutrition and she studied obesity, and she was there at a time when rotavirus vaccines were introduced and where rotavirus mortality and disease burden was going away. So I've seen in my own lifetime and in my own family the difference and the magnitude of change and the perspectives of global health that have occurred in only the last 45 years. I've also seen that 45 years ago, life expectancy in Latin America throughout the region was on the order of 56 years. Today it's about 74 years, and life prolongation has occurred at the rate of about 3 years per decade. That means that in this 10-minute speech that I have to give, you will each live 3 minutes longer, so you can afford the dessert. So it's really quite remarkable. And because of the prolongation of life, the health problems and the health research questions and the ways we approach this in the future have to change enormously. How will they change? And that's what I'd like to talk about. First, we still have the problems of maternal and child health that are with us, maternal mortality, child malnutrition, and health and issues of health equity and health inequalities, which remain with us today despite the massive advances that we've all appreciated. But we also have a changing pattern that global health today is no longer just the infectious diseases or the tropical diseases, but they're the chronic diseases which we all share. Diseases of obesity, of cardiovascular disease, of cancer, diabetes, mental illness, and the like. And when I took over at the Fogarty, we completed a study of the global burden of disease, and it turned out that these were the priorities, especially for Latin America. Well, what does that mean for our portfolio at NIH? We've gone on now with our new director, Francis Collins, to put global health front and center as one of the 5 pillars of where NIH will be going. And we've set up a series of projects and activities to expand the activities in global health to all of the 27 centers and institutes. How has this occurred and what's happened? Well, in the Institute of Cancer, the National Cancer Institute, an investigator, George Gomez, has linked up 5 countries to think about breast cancer. Breast cancer is the #1 cause of cancer in women. We have breast cancer common throughout the region. We share that as a problem. And it's only by looking for biomarkers, by doing clinical trials, by working together that we can actually do the studies that need to be done. And in the course of that interaction, we hope that the quality of all research in the field of cancer will increase. It will also involve bringing in the public sector and the private sector as participants in this activity. The New York Times, about 6 weeks ago, had on its front page a picture of a community in Colombia outside Medellin, where a family with Alzheimer's was pictured. Alzheimer's that occurred in people who were 35 to 40 years of age. In the United States, in 30 years, 1 in 3 adult Americans, aging Americans, will get Alzheimer's before they die. And it will be a disease that will cost us literally several trillions of dollars. We won't be able to afford it. And unless we begin research to address this problem, we will have tremendous difficulties in distributing care. How will we be able to overcome this? How will we be able to confront the disease and pay for it in 30 years? Well, the answer may well come from this community in Colombia, where people are getting their disease at 35 and 40, where we can study biomarkers of the disease early on and the aggressive progression, and we can begin to think about basic pathophysiology, cures, and how to address this. We have 20 or 30 years before we're overwhelmed. So any prolongation or delay in the onset of Alzheimer's will give us tremendous return on investment. That's a problem where we will have to work together, North America, South America, all of us, as our life expectancy is prolonged. And it will require tremendous input from the private sector to understand issues of imaging, of new drugs, of clinical trials. It will really require a consortium effort of all of us involved. The partnership, then, is going to be key to how we advance our medical research agenda in the next decades. Partnership within the region and partnerships between specialties. Partnerships with industry are also going to be key. My own experience for 30 years has been working with rotavirus vaccines. And it was a virus that was not discovered when I graduated from medical school. And it's a virus that now has almost gone away in the United States through the use of vaccines from several companies and through long-standing partnerships. In January of last year, the first demonstration that rotavirus could stop mortality in a country was demonstrated by Vesta Richardson in Mexico through a national program. We'd like to see that kind of results throughout the hemisphere, and it will only occur through expanded programs, high coverage, and good monitoring of impact. But we can learn a lot in other areas, and public-private partnerships are going to be another part of this activity. Melinda Gates last week spoke about the fact that wherever she went in the world, she could find Coca-Cola and Pepsi-Cola, but she couldn't find children who were immunized against common diseases or adults who were taking antihypertensive medications. Now, clearly, an antihypertensive medication is probably more important to deliver than a soft drink. So we have a lot to learn about delivery, marketing, logistics, and working with the private sector to learn the lessons that need to be learned to allow us to deliver meaningful and effective interventions into the future. It's also working with the private sector that we're going to have to understand the root causes of diseases like obesity, which has become a national epidemic in the United States, and which was the subject of my daughter's study in Peru, the growing epidemic of obesity. There are many approaches to this problem, both nutritional, exercise, as well as molecular in the human microbiome. The Lasker Award this year is going to the discovery of leptins, which are important for obesity. So we need really multiple approaches to this disease if we're going to conquer it. Even dinners like this will lead to obesity if we don't handle ourselves well. So I think this is a real challenge for us as we go forward. I think I want to leave you with several messages. One is that partnerships within the Americas will be key if we're going to advance research and advance discoveries with all the new tools we have of genetics, of communications, molecular imaging, and the like. So partnerships will be key, and those will be within the region and within the public and the private sector. And we have to work on those relationships very carefully. The second is that I've worked in the Americas for 45 years because I had what I call early childhood education. I went to Argentina, Brazil, Chile when I was in college. I learned Spanish and Portuguese, and I'm still using them today, and I still have collaborations in the region. I think that those collaborations in research, the exchange of people researchers who are young, who can be enthused by the challenges that disease prevention provides. Young people will really be the key to addressing these vital questions as we go ahead. So broadening partnerships, addressing the issues of health disparities, because even in the city of Washington, we have rates of disease that are similar for HIV, for instance, to areas in the developing world. So health disparities is an issue which we all have to address. I want to end then by just applauding PAHEF and PAHO for the major contributions that you have made to improving the health of the whole Americas region, and working together to build these partnerships within the region, in fostering young people's fellowships and scholarship, and in trying to link public and private partners as we go ahead. Congratulations to you all. It's dinner time. Thank you.